Sonya's not far away. How are you guys?
Good.
No.
You all good? You right to go? Good. I've just got usual numbers of the day, and then we'll go to what brings us here to Banya Fields Kinder, and some very exciting announcements in relation to early childhood education. So 38.1% of Victorians 18 and over have had 3 doses of the safe, free and effective COVID-19 vaccine. This time last week it was about 31.1%, so those numbers are steadily building, and that's critically important in terms of protection, particularly as we look ahead the rest of the year. Winter, some of the challenges we have every winter, but particularly if we get that combination of COVID and flu, being 3-dose protected is incredibly important. Take some pressure off our nurses and AMBOs, all those that work across our health system. More than 2 million Victorians have had a 3rd dose, but still 2.1 million are eligible and have not yet had a 3rd dose. So again, we appeal to all of those Victorians who are eligible. I think it's only a matter of time before the relevant federal agencies confirm that this is 3 doses, that it's not 2 plus a bonus. It really is 3 doses in order to be protected, not just against really critical illness, but to be protected or to minimise the likelihood that you get it and that you give it to the people that you love. But we'll wait and see how that unfolds over the course of the next week or so, I think. 63% of Victorians over 70 have had a 3rd dose, 54% in their 60s, and 48% of those in their 50s. So again, all of those numbers are building, but we do need to do more, and we do need to do better in terms of hopefully matching our 2nd dose, our 2-dose performance, with our 3rd dose performance. 23,863 doses were delivered yesterday at state sites, plus work that will have gone on in community pharmacy and also in GP practices, and we thank them for the partnership. There's currently over 230,000 bookings available over the next 30 days in state-run vaccination hubs. So it's never been easier to go and get a 3rd dose. We have vaccine. It's not like last year where there were some supply issues. We have the vaccine. There are appointments, there are arrangements for walk-ups, there are pop-ups that are beginning in school communities this week and next week, and of course there's the grants we've provided to GPs and community pharmacies just to go that extra mile to take the vaccination program into local communities as much as we possibly can. Just on childhood vaccination, 5,396 little ones got their vaccine in state-run centres yesterday, plus of course GPs will have done that work too. 243,883 kids aged 5 to 11 have at least 1 dose to date. That's good, strong performance in a relatively short period of time, but we know that there's a lot more to do there. We thank every parent and our little kids for going along and getting vaccinated. It's really critically important. You can't get to the level of protection that a 2nd and a 3rd dose, so a complete course, gives to our young kids until, of course, they begin that vaccination journey. So those 1st doses are very, very important. There are, I'm told, around 87,000 appointments available for children aged 5 to 11 in state-run centres over the next 30 days, and of course many more through primary care. So again, it's never been easier. There's never been more supply than there is right now. Please, to mums and dads out there, just as it's important that you're vaccinated, 1, 2 and your 3rd dose, it's critically important that your kids are vaccinated too. Now, Auslander here, and it's probably appropriate just to go through a couple of sites where most of those appointments are. 31,000 of those appointments I just referenced are available in the next 7 days, and there are thousands of those 31,000 available at the Royal Exhibition Buildings, the Austin Repat Hospital, the Campbellfield Ford Complex, Sandown Racecourse, Melton Bunnings, and if you want a full list of those walk-up sites, because we've expanded it, no appointment needed at a number of sites, please just go and visit coronavirus.vic.gov Now, in terms of hospitalisation and those numbers, 889 people are in hospital. That's significantly down from 953 yesterday, and a 7-day average of 995. 111 people are in intensive care, down from 114 yesterday. 35 are on a ventilator, down from 39 yesterday. And sadly, I have to report that 20 Victorians with COVID-19 have passed away. 10 of those in the last 2 days. We, of course, send our sympathies, our condolences and our best wishes to their families. This will be an incredibly difficult time for them. In terms of case numbers, 6,110 self-reported positive rapid antigen tests. A further 4,479 people received a positive PCR result, from a total number of... Actually, no, sorry, I don't have a total number of tests for you. I'll get that if I can. That's a total of about just under 10,600 cases reported to us yesterday. The 7-day average was 12,659, so that's coming down. The previous week's 7-day average was nearly 19,000, so again we're seeing that positive trend, a more optimistic picture than even our modelling predicted. And the total number of active cases in the community, 78,294. This time last week, that was 191,058. So you can see a very significant reduction in the number of people in the community that have COVID. Of course, these are established cases via positive tests. There will be more virus in the community than that. That's always been the case. That's why we have mask rules. That's why we have not many rules, but they're all well-founded. They're all about common sense and just everybody playing their part to try and limit the spread of this wildly infectious, less serious, but still serious. We still have the better part of 1,000 people in hospital. The vast majority of those are in ward beds because they're genuinely unwell. Previously, we had many more people in intensive care who were gravely unwell. This is still not something that anyone wants to get. It still can be very, very serious, in fact tragic, as we've had to detail each and every day of these last few weeks. Now, in terms of Banyafield's Kinder, thanks very much to the staff here, thanks very much to parent community and everyone who's welcomed us here today. This is a fantastic example of what early childhood ed looks like across our state. The important thing today, a little while ago we promised that we would add, basically double Kinder and early childhood education across our state, that we would offer supported places, so saving families thousands of dollars each and every year, and we go to 15 hours of 3-year-old Kinder. All the international evidence shows you that if you invest in 2 years of early childhood education rather than just one, then you change the life opportunities, you change the lives of so many young people as they get older. This is all about brain development, socialisation, education beginning much earlier. It's great for parents, great for families, great for people to get back into the workforce. It's really obvious. It's a great thing to do. We've made very significant progress. Some 21 regional local government areas are already delivering at least 5 hours and some more than that. And today we can confirm that the balance, so all 79 local government areas from this week will be delivering 5 hours of 3-year-old Kinder to literally tens of thousands of our smallest Victorians. Enrolment numbers are not confirmed till the middle of the year, but I think it's safe to assume there's going to be tens of thousands of little kids, just like Archie and Harvey and Peyton and so many others. This is fantastic for them, fantastic for their parents and for the broader Victorian community. The other way to look at this too, obviously we've had to recruit to deliver this commitment, and we are delivering it in full despite the challenges of the pandemic. We are in the process of recruiting another 6,000 early childhood teachers and educators, and we're creating over a 10-year period 5,000 construction jobs as we build new classrooms, upgrade kinders, essentially doubling this sector so that it can do double the work and have at least, I think, double the benefit for our Victorian community. This is really fantastic. It's about cost of living, it's about education, it's about the best start in life. It's also about jobs and skills. The way we've been able to support the attainment of the qualifications to work in this sector through TAFE, a TAFE that was smashed previously. It has now been, that damage has been repaired, and it's now well on the way to being better than it's ever been. I'm joined today by Ingrid and Sonya. and Ingrid's doing a fantastic job in this space, critically important work. And I might now hand over to her to add to my comments, and then we're happy to take any questions you have.
Thank you very much, Premier, and I'm thrilled to be here today. Today has been a long time coming, and as the Premier says, it follows the successful rollout of three-year-old kindergarten in 21 regional local government areas across the state. And I'm absolutely thrilled that from this week all three-year-old children across Victoria will have access to a three-year-old kindergarten program funded by the Victorian Government, beginning with 5 hours a week and building up to 15 hours. And this has been a collective effort on the part of so many, and I want to particularly acknowledge the hard-working teachers, educators and providers across the early childhood sector. It's been a tough couple of years, and they've managed to be able to keep our youngest learners engaged at the same time as getting ready for what is a nation-leading reform. And I'm incredibly proud of the work they do, and I want to make sure they understand how important they are in the success of building the education state. And we know that all the research tells us that 2 years of early childhood education is life-changing and can give children such a great trajectory for the rest of their learning years and getting them ready for primary school. So this is really important reform that I'm incredibly proud our government is right behind. I also just want to wish every three-year-old and their family a fantastic start to the kindergarten year. I hope that they can make new friends and learn new things and put them on a really fantastic footing for the rest of their school years in Victoria. The kinder kits, which we've seen today, will be going to every three-year-old child in Victoria, and they are packed full of really fun activities that parents can enjoy with their children at home, and it will give them a real insight into the power of how play helps develop education for our youngest learners in Victoria. This is a really proud day, and I'm thrilled to be here at this beautiful kindergarten with the Premier and with the local member, Sonya Kilkenny. Our government is really committed to making sure that three-year-old kinder is available right across the state, and this is an exciting week, and I thank everybody for their hard work in making today possible. Thank you.
Very good. We're happy to take any questions you have.
You're going to go any further with kinder in terms of border policy and the election for November?
Oh, well, we wouldn't rule out adding to what's a very strong record of following the educational research, following common sense. I think if we can look after our kids, intervene earlier, provide them with all those soft things, socialisation, friendship groups, play groups, right across the board. We've made massive investments in this sector, and we've got a big agenda. We're rolling it out on time. It's great news for families across the state. This is a $5 billion project. It's a long time since any state government invested $5 billion in our littlest Victorians and their families, and I reckon they're worth every dollar. And I think that our community, our economy, all of us will benefit from this in the years to come.
Just going back to our COVID numbers,
Yep.
It's a very different story from last week, especially when the state government got a part that we're definitely over the peak and things will get better, especially with school starting.
Yeah, I was talking with the Chief Health Officer earlier in the week, and he's certainly of a view that we've seen that peak. I think school coming back, which is critically important, day one, term one, it'll be challenging, be a bit messy in parts, it's not easy, but our staff, our students, parent community, everyone's working as hard as they can, and we'll do our very best this week. And over this first 4-week period, we'll be doing the 2 rat tests per week. I think that going back to school, there will be cases that'll obviously add to our tally, but the benefits of having school back far outweigh those sorts of challenges. But it's certainly the view of many experts that we're past the peak. The data would certainly indicate that. But there's still very significant pressure in our health system, and I just want to give a shout out to our nurses and ambos and doctors, cooks, cleaners, ward clerks, everybody across the board. They're doing an amazing job. It's very, very challenging at the moment. And without them, well, we all know, they save lives and change lives every day. And that's why that's why it's so impressive that all of us, despite the inconvenience, despite the fact this has not been the summer that we kind of all wanted, we're all making those sacrifices to support the people who keep us safe and who we need the most. those health professionals who through care and compassion and amazing skill levels do simply amazing work. None of us should be adding to the pressure in our health system. That's why it's regrettable we've had to change the services we offer. But we'll have those back up and running as soon as we can, and certainly these numbers are more positive than we had hoped, and let's hope that trend continues. But that's all in our own hands. The way we conduct ourselves, the way we follow the few rules that we have, and the rate at which we all go and get a third dose. We know the third dose protection will keep you out of hospital, but will also reduce the transmission. It'll lower what they call the attack rate of this virus. So it's just, it's not 2 plus a bonus. It really is 3 to keep you and the people you love safe.
Have all schools received?
New South Wales has, sorry, if you want to go on schools now.
I was going to say, have all schools received their RATs and their purification units now?
I believe so, yes. There's been an enormous logistical effort, whether it be delivering more than 50,000 of those air purifiers. After, of course, we had surveys done using CO2 monitors in many spaces. They're in all the classrooms where there's a need to have that additional protection. And as far as I know, as of Friday, there had been, I think, something like 4 million rapid antigen tests with schools at the moment. And then there'll be more deliveries next week and the week after. So it's been a massive task, and I thank all of those who've been involved in it. And indeed, I thank parents and students, and particularly teachers and staff, principals. This is not the kind of usual day one, term one, but gee, it's important to have our kids back.
Kinder won't look like that, though. What will Kinder look like in terms of that kind of stuff?
Staff having a couple of RAT tests each week, consistent with National Cabinet, consistent with the arrangements that Premier Perrottet and I have essentially agreed on. Students are not tested. We'll closely monitor that. That's supported by public health advice as well, but we'll wait and see how that unfolds. But the key point here is, despite the big challenges, despite how complex it is to get all these things done, we are going to have our kids back in the classroom tomorrow. Some have even started on Friday. That's a great outcome.
So students don't need to be tested if they're in the same classroom as a positive case, is that right?
What you do is if you are a positive case, so if your son or daughter tests positive, you inform the department. The department informs the school.
So I'm talking about Kinder.
Oh, Kinder.
Yeah, so if you're in the same class as a positive case in Kinder.
I think it's all about monitoring for symptoms. And any child that is not well shouldn't be going to Kinder, shouldn't be going to school, shouldn't be going out, really. Chances are, well, there's a fair bit of respiratory disease around at the moment, actually, but with a wildly infectious global pandemic on, then we just all have to be extra vigilant to make sure that we're monitoring that our kids are well, and if they're not, then they shouldn't be going out, to public places. They shouldn't be going and having sleepovers with friends, and they certainly shouldn't be coming to Kinder or indeed childcare. But it was judged, common sense and public health advice. It's pretty challenging, I think, to be rapid antigen testing 2- and 3-year-olds, because that's just challenging.
Premier, the New South Wales government counterpart, friend Dr. Perrottet, has unveiled a $1 billion package for its businesses, given the Omicron wave and I guess lots of Omicron anxiety out there with people not going out and supporting businesses. Why is there no business package for Victoria at this time? And New South Wales apparently are angry at the federal government aren't chipping in for that package. Has Victoria lobbied at all for some help from the feds when it comes to business?
Well, a couple of points. I think that the New South Wales government have made their announcement like an hour ago or something, so I'm here talking about a $5 billion investment in giving our little kids the best start in life. So it's not like we're not supporting people. We're doing everything we can. We'll make announcements, at a time where we are ready to do that. That's been our record. We have, I think, provided $10 billion plus worth of business support. We know that many businesses are doing it tough, particularly smaller businesses. But that $10 billion is very real. It's been paid out in record time. It's made a real difference. That's not to say we won't do more, and that can come in lots of different ways. Everything from grants and waivers all the way through to vouchers, so that people are out there, particularly as we see these numbers fall, encouraged as best we can to be out there enjoying the very best of Melbourne and Victoria, food and wine, all of that sector, for instance, which has been pretty hard hit by a lot of bookings that they've been open. They've had some density limits, but the bigger factor has been people making their own judgments, not necessarily to move as freely as they otherwise would.
And on that, if Victoria does go, I know you said we haven't got an announcement yet, but the current system that the JPR set up with VCAP businesses that are currently in the system,
Yep.
Save Victorian Events told me the other day, essentially they're already in the system, they just need the government to get going on another round of grants. Could it be as simple as that?
Well, let's be clear about this. Our grant system has always been based on hardship. It's always been based on those that have lost the most. And we wish we didn't have to provide that sort of support. We wish that this global pandemic had not done the sort of damage that it has done. But we monitor that constantly. I speak with Premier Perrottet and other First Minister colleagues regularly. They've made their announcement today. We'll have more to say about these issues in due course. Where you can be aligned, that's obviously important. But I think the unifying principle and the alignment that matters most is in kind of two parts. We have paid out $10 billion. That's a very substantial amount of money, and just as New South Wales have paid out very substantial amounts of money over the journey. But the second unifying principle between us and New South Wales and every other state, I think, is that our payments, our support, are based on hardship. And that's the way that it will be in the future. And when I'm ready to say more about that, Simon, I shall.
It's great to see the state's active cases going down, but there are reports that outbreaks in aged care facilities in Victoria are going up. Obviously, it's a federal responsibility, but we still do have all the public sector ones. Have you still been briefed on that situation? Are you concerned?
My last update was that there were active cases in, I think, 5 state-run aged care facilities and active cases in 110, 120, I think, private-run facilities. Could even be more than that, actually. So you're right to say this principally is a federal government matter, but we're there to help, we're there to assist, running away from responsibility and not no one benefits from those sort of arguments. I'm very keen to work with the Commonwealth Government. I know ministers talk regularly. We've had various policy responses over these last couple of years, and that's made a really challenging set of circumstances just that little bit easier. So that gets monitored closely, and I'm sure Minister Colbeck, Minister Hunt and indeed the PM are very focused on that. Rolling out boosters is very important. There's still a little bit of work to be done there. But we're the biggest aged care provider of any state government. No other state government across the country has as many aged care beds as us. So we run our own system, and I want to thank the staff who run it, because they run it very, very well. And COVID numbers is one metric. There's lots of other metrics, but we have staff to resident ratios. That makes all the difference. All the difference. But let's not forget all those people who are working in aged care at the moment, because it's pretty tough.
You mentioned 10 of those 20 deaths occurred in the last 2 days. Could you just clarify when the other 10 occurred, maybe relate to their reporting?
No, I think what it means is that 10 will have been reported to us overnight, and 10 will have been reported to us. They all will have been reported to us overnight. 10 of those will have been people who sadly passed away yesterday, and 10 of them will have been people who passed away the day before. That's the way I read it, but I'm happy to double check it for you. We get those reports. It's tragic. We wish that we weren't getting those reports, and we wish those families were spared the pain of losing a loved one. But we faithfully report them as quickly as we can. I'm more than happy to chase it up. That my interpretation is accurate.
How concerned are you about the new son of Omicron, so-called subvariant that we now know is in?
Yeah, look, the Chief Health Officer, I think, has made some comments about this. We monitor, just as the Commonwealth Government do. So Professor Kelly, Professor Sutton, all of them monitor for different international experience, whether it's subvariants or indeed another variant of concern at some point in the future, which may be part of the challenge that we face. That's monitored every day. And I think that, I was talking to Prime Minister Ardern the other day. We're talking about some of the challenges they're facing. Everybody's talking to everybody, and I think that's really important, just to learn from each other, to have the most complete picture. I don't have any advice to be particularly concerned about that, but that may change, and if it does, then we'll be sure to let you know.
During the week, you said QR codes would be here to stay for the time being, at least. SA has since changed to it only being compulsory in high-risk settings.
Yep.
Is that a proposal you would consider at some point in the near future?
Oh, look, I look forward to a time when we don't need QR codes at all, regardless of high or low risk settings. But the simplest and easiest thing to do is to leave the settings as they are now. That's not forever. Hopefully that can change at a time in the future. If you've got the vaccinated economy running the way we do, then the QR code is less about where you've been, although it's quite helpful if in fact you are positive and you want to check where you've been, then your app gives you that history of everywhere that you've checked in. But it really is a tool to make sure that only those who are double dose and I think at some point triple dosed are out and about. Those who are not vaccinated have made the wrong choice. They've made a choice that puts so many other people at risk. I could not be clearer about that. The vaccinated economy is here. Mandates are here. We didn't get to 93% without mandates. We only got to that unique level of internationally significant level of vaccination protection by mandating. They weren't easy choices. There's already been some mandating done for third doses, and there will be more. And that's all about keeping us safe. Whether that's popular or not, that's not my concern. The politics of this doesn't work against this virus. You've got to make difficult decisions and then push forward from there. That's exactly what we've been doing. So QR's here for a period of time. I can't tell you how long. I'm not criticising others. They've made different judgments, but our vaccinated economy operates and it is central to that operation to have QR coding unchanged. But let's hope we can have all these settings changed. I've said so many times, rules will come off the moment they're no longer needed, and you've seen that over these last 12 months.
Just on the mandates. So yes, the opposition leader this morning came out and said that he would not support the dose mandate. And speaking in his press conference earlier, he said that the reason for that is the mandate dose 4, dose 5, dose 6 if it eventually gets to that. And when asked if a target would have recommended the third, he basically said that the mandate is just not needed from now. What's your response to that? And I guess this whole notion of will we see mandates, dose 4, 5, 6 if it's recommended?
I think, you know what's mandatory? Following the advice of experts. So I really don't have anything else to say about anything he said today. I'll follow the advice of experts. And I think we're very close to a situation where the relevant federal bodies will determine that 3 doses is what's considered fully protected. As for 4th and 5th, let's wait and see how this goes. Being vaccinated saves lives. The notion that this is somehow a bad thing, like the people who would least like to be considered as part of the mainstream are essentially getting themselves very confused and almost adopting some of this anti-vax language. That just doesn't make any sense to me. Vaccines work. That's why, yes, sadly, we have some people who've passed away, and again, we send our deepest sympathies to their families. But it would be thousands and thousands more, particularly given the wildly infectious nature of this Omicron variant, if we hadn't got to 93% and if we weren't out there every day pushing boosters, or really what should be referred to as third doses. The term booster kind of gives people the impression that this is an optional extra. It's not. All the evidence supports that. I think it's only a matter of time before the decision comes down to formalise that.
Are you concerned from a public health perspective about long COVID in Victoria and the effects of COVID on Victorians after they are no longer infectious?
Yeah, well,
particularly when it comes to other diseases that it may lead to or it may shield, for instance, leukemia.
Like, I wouldn't get into kind of talking about detailed tumour streams within cancer. I'd leave that to experts. But look, what I can say is that this is a novel virus, which means its impact, its medium and long-term effect, because it's a novel virus, you can't be certain. That's why we've done so much to protect people, not just from the kind of immediate risks, but from some of these well-documented and I think increasingly clear issues of long COVID with some people. Not everybody, but with some people. So I would leave any further comment than that to those who are trained to make such comments. But yeah, of course, we're concerned to have less cases, not more, to provide people with all the support they need. And I do expect that there'll be support needed from some people who've been COVID positive for quite some time. For quite some time.
Just to be clear, you said before the use of anti-vax language. Were you referring to the opposition leader?
No, I'm just talking about the fact there's a lot of anti-vax language around the place. There's a lot of people who continue to refuse to accept the logic, refuse to accept the facts, and that is that vaccines save lives. They're free, they're safe, and they're incredibly effective against very, very serious illness. In terms of the question you've just asked me, I think I made it clear earlier on, I'm not here to comment on him or any of those issues. I'm here on behalf of the Government of Victoria to make a major announcement in relation to early childhood education and our position on keeping people safe and doing everything we can, even if it's unpopular, is very well known.
Can I ask the early education minister?
You absolutely. Any more for me?
Oh, I have a quick one.
Sure.
Sorry. You mentioned you've been speaking to Cinda afternoon.
Yep.
Have you spoken to her about the resumption of quarantine-free travel?
No, we don't. They're obviously national matters. That'd be a matter for the federal government to be engaged with the New Zealand government. We talk fairly often, and we had a chat about Omicron and what that'll mean. We're talking about rapid antigen tests. We're talking about all sorts of different things. But they're facing so many of the challenges that we've already faced. They're a little bit behind us in terms of the onset of this variant. But it's always good to talk to peers and talk to people who are running similar sized places and just to try and learn from each other. That happens in the sort of political community, but it also happens between medical experts, researchers, and I think we're all stronger for it. It's a global pandemic. I mean, all of us have to be engaged. Over to Ingrid. Sure.
Did you watch that party?
Yeah, I did. It's fantastic. She's just a star, and her values, her character, her integrity is there for everyone to see. She is a sportswoman for the ages, and someone that women and girls, and indeed all Victorians, can be so proud of. Congratulations to her, and we wish her well.
So just on what kinders will look like this week, the Premier obviously mentioned that kinder teachers will get enough RAT tests.
Yes.
Is there any talk of expanding that to the early education sector generally, not just kinder teachers?
Yes, we have already announced that we'll be providing surveillance testing kits for the entire early childhood education and care sector. So that includes not just our sessional kindergartens, but also long daycare centres that are actually the responsibility of the federal government. But we thought it was incredibly important to make sure that right across the sector, no matter where parents choose to send their children to kindergarten, that surveillance testing and the kits are available for all of our staff in early childhood. Thank you.
Well, good. Thanks very much, guys.
Thanks.
Enjoy the rest of your Sunday.